This exercise is called the hip airplane. I'm going to show a few reps and then I'm going to talk through what we're trying to get out of this. So the exercise, I'm going to start foot straight, knee out over the third and fourth toes, sending the butt back. I'm going to balance on that leg. I can start near a wall if I need help. And then I'm going to come into a hip hinge. So feeling maybe a little hamstring stretch, hopefully a little work here. And then I'm going to rotate my outside pocket up to the ceiling and then down to the floor. Up to the ceiling, down to the floor. So I'll show that kind of straight on. I'm coming here, hips are level, hips back, stand on one leg, my hips are still level. I'm sending my whole hip unit, this outside pocket up to the ceiling, and then I'm sending it all the way down as much to the floor as I can. And then I'm coming up there. I'm trying to minimize as much wobble in this leg as possible so you can place fingertips on something if you need to. So we use this exercise in a couple different circumstances, but I really like it because it integrates foot and ankle, hip with the knee in between. So depending on what you have going on, we might use this for some foot and ankle injuries, some knee injuries, or even some hip and back injuries. So what we're looking for here is first we start with the feet straight because we're going to try to get at what I call a stable neutral foot posture. So if I start out like this and then I bend my knees, you can see my foot kind of wants to collapse there. So what I'm looking for is feet straight. I'm going to show just an angle here. Feet straight, I don't want to collapse in, but I also don't want to roll out. And so my toes are relaxed, my big toe is on the ground. I'm going to rotate my knees so my center of my patella is over my fourth toe. That's going to slightly raise my arch, just that hip rotation there. Okay? And then I'm going to send my hips back. That's going to engage my glute, and I'm going to just balance and try and maintain this hip, knee, foot position. That right away is going to activate a lot of the muscles we're going for, the posterior tibialis, some of the arch muscles, the glute here. Then we're going to challenge things even further by making it dynamic. So I'm going to send this back pocket up to the ceiling. I'm not rotating from my back, meaning I'm not twisting, that just made me fall, but my hip muscle here is contracting to send this pocket up to the ceiling. And then I'm going to slowly lower it. This is an eccentric contraction now. And I'm going to come here and then back up. You can see this whole time, my foot and ankle is kind of firing up to stabilize that. So I feel a lot of work around the whole foot and ankle, and I feel a lot of work in my hip. The key here is that I don't want to claw with the toes. So if I over-engage my toes, that pushes my foot outward. The body tends to compensate by either falling outward or by throwing everything inward, and now we're in this kind of collapsed foot position here. So I don't want to overuse the toes. Second, I don't want to move too quickly, so slow and controlled so you can feel what's going on here. And third, don't be afraid to use a little assistance. So start near a wall or something. If you can, don't grab the wall real hard or push hard against it, but just run your hand up and down the wall. So I'm going to come into this position, stable foot, knees where I want it. I'm going to rotate up and rotate down. And you can see right away, just this hand on the wall makes me a lot more balanced. I have greater stability and maybe a greater chance of feeling what I want rather than if I started too shaky. Okay, so that's the hip airplane. When you're done this one, should feel work through the entire leg, but hopefully no pain.